Good morning or good afternoon, whatever time you guys are listening to us. Welcome back to another edition of the Layman's AI podcast. I am Adam,
Hey, my name is Brian.
and we want to welcome our listeners back as we do episode 60. And Brian, there's a little bit of a twist this week. Usually we let AI plan our episodes that end in zero, but for this week, because we have a guest, we decided to just cancel that. And our attitude was kind of like, you know what, it's our show. So we'll do what we want. And so we went with the
I guess so.
opportunity to interview somebody. Yeah, that's just how we roll sometimes, you know.
Yep.
Sometimes things don't work out the way we want it to. But we're very excited because we have a young man with us. His name is Peyton Fry, and he is the CEO of Glass Raven. And say hello to everybody, Peyton.
Hey guys, glad to be here.
Yep.
And we're
Happy to have
happy to
you.
have you. I'm going to do a little bit of an intro here. So this is again, this is Peyton Fry. He is the founder and owner of Glass Raven, a healthcare consulting and analytics firm specializing in patient access optimization. Oh, there's some big words in here, but I got this. With a focus on bridging the gap between healthcare operations and digital tools. He helps organizations leverage data to drive transformation in referral management, call center efficiency, and clinic capacity utilization. Peyton's earned his Master's of Health Administration following his Bachelor's of Science in Biomedical Sciences from Texas A&M University. He has worked with organizations like Houston Methodist and Intermountain Healthcare to align and connect executives, mid-level management, and frontline staff to data-driven decisions and scalable patient access outcomes. His expertise lies in translating executive priorities into practical, data driven strategies that improve patient access and healthcare delivery with the appropriate digital footprint. As a thought leader in digital health, Peyton is dedicated to empowering healthcare leaders with the insight and the infrastructure needed to create meaningful and lasting change. So, Peyton, welcome to the Layman's AI podcast.
Yeah, I've been looking forward to this.
Us too. So thank you
Yeah.
for reaching out to us on LinkedIn. We are excited to have you. And we've already done, for our audience, full disclosure, that we've already done a little bit of a vetting with Peyton. We've gone through what he does. And I'm kind of excited about this because some of those questions that we asked are tailored towards things that we brought up in our little bit of a vetting conversation. So, Peyton, I'm going to dive right in and get started. Here's question number one. Uh, Before founding Glass Raven, you spent about 5 years working inside major healthcare systems. What problems did you repeatedly encounter that convinced you had a better approach?
Yeah, so I would say that, if we talk about even like the intro, it is a mouthful. Talk about, like optimization and all these IT pieces. And I ended up having to describe my role even, before I started the firm as somewhere between IT and ops. Healthcare has this problem where they are dominated on the IT side by their medical record system, and all and any energy they have goes into developing, their infrastructure there. And it's for clinicians and kind of the patient interactions, and it doesn't always translate to the business side of pieces. Where I started my career was working with the access scheduling groups, so not there in the patient visit room. They're way on the back end or outside of it, over the phone, and they just did not have the same technology support. Specifically working with call centers, where there was almost little to no investment, and them really needing a way to move from an operation that made sense to technology that made sense, and there just being the gap there. And how do we break out of these silos? How do we make sure that we work for the technology and the technology doesn't? Like how do we make sure the technology works for us and we don't work for the technology? Because a lot of people, how do we keep it from becoming shelfware when we buy it and we don't use it? Or how do we keep it from, dominating everything that we do to where we can't operate outside of the technology?
Right.
um, you know, Translates well into, not just technology, but, the larger AI conversation.
Yeah,
Absolutely.
I'd say that's kind of our theme a lot of times. And I like hearing more people saying stuff like that. It's like don't let it do it for you. But yeah, I it's kind of the theme of our show. But either way, next question, saying that organizations want to use AI simply because it's AI. What questions in your mind should a company ask before deciding, is AI the right solution for me?
Yeah. So I would say before you even ask the question, is AI the right solution for me? It's, what problem are we trying to solve? It's like a lot of people will engage on, can we work with this technology or this technology? And I was like, well, you sure. The answer is always yes. Can you work with technology on that? Absolutely. I was like, there is some version where technology is going to improve that problem. If you understand what the problem is and where you want it to go. Is solving that problem meaningful to your organization? How do we keep whatever we implement from going onto the shelf? Well, we make sure that it's, day to day going to work for our operators and the people that use that piece of technology. So, like, is AI going to be a great solution for this? I mean, if that is where the conversation goes, and we've decided that technology is the right call, now are we deciding between, basic software and newer AI solution? Is our process structured? You know, like if you can't write down the process for me, AI can't follow it. The same way, software generally can't follow it, but with AI, it's just that problem is exacerbated. If the process is not structured, AI is probably not where we want to go as our first point of contact. We probably want to take a look at the operation first, structure that process, and then come back to talk about what technology is the best option.
I like that.
Yeah,
I like that. This goes a little
definitely.
bit. This next question, which piggybacks off of the question we just asked you, goes into the conversation you and I had, where you and I had both had the exact same thoughts.
Yeah.
It was pretty funny because I know Brian wasn't there, but I know he agrees with this. Before recommending any new technology, even if it's AI or not AI, Glass Raven first determines whether a client's existing systems is working correctly. So, what does that evaluation involve, and how often is the real problem the technology they already have?
Yeah, so I'll say this is probably where, our, experience in analytics comes so far into play is, what are we trying to improve as an organization? You can have the conversations around, mission and vision. But like when it comes down to when do we know if it's good or bad, let's have a conversation on, evaluating if we have a problem. And is that problem worth solving? Are there real dollars attached to that? Like I lean heavily on call centers because, call centers have been around for so long. There is methodology for is it good or bad? Like classic measures like how many phone calls did we miss? How long do people wait before they are, answered? Are they waiting 2 minutes or are they waiting 30 seconds? It was like if they're waiting 30 seconds, I was like, it's really hard to get from 30 seconds to 25 seconds. You're going to invest a lot of money saving those 5 seconds with whatever technology you do. If it's operations, if it's tech based, whatever you're going to do. Um, Now, if you're moving it from 2 minutes to 30 seconds, that's probably actually the same amount of work, from moving it from 30 to 5. So it's, very much like let's pick a metric that's meaningful to our organizational from a financial perspective that we can then, attach to solution options. Is it hiring more staff? Is that the cheapest option? Or is it implementing a solution that's going to be available around the clock? Or is there a security component to where, even if it's more expensive, having a technology solution that's always available 24 hours, 365, that's going to meet those security requirements. That's kind of where we start on those pieces.
Mhm.
Excellent.
Yeah, very nice. So, obviously healthcare organizations and medicine in general collect massive amounts of data, massive amounts. And like what do you think they got to do in order to make sure their data is reliable and ready, like before we start, putting AI into the fray here?
Yeah, but to say it's like the phrase everyone is now familiar with, garbage in, garbage out.
Hmm.
Yes.
Especially, exacerbated with, the AI problem of, now the AI will take your content, say, wow, you regularly make it look like this. I'll make more stuff that looks like that. It's like, please don't. It was like,
Yeah,
it's like,
definitely.
Yes.
I was like, we don't need to propagate, our bad habits, which is something that, I talk about, like, if our process today is bad data cleanliness, throwing AI at it is going to have it replicate our bad processes.
Hmm.
So
Definitely.
there, it's you know very similar, I think, to how general technology platforms should evaluate. Like if you're just going to put the data into Excel and then do math there, kind of the same process. So it's doing kind of the grunt work of going through and let's take a sample and look at those records in detail and see if that if we have in data matches what we see in operation. For an example, like I've been recently looking at some projects of filling appointments where, why are the appointments for patients getting canceled? And I'm
Hmm.
like, it's like 50% of the time they're falling into a category is unspecified. And I was like, what are we? Because I was like, we're hiding something.
Uh,
And I was like, so we need to go back. First of all, before we talk about, what behaviors do we need or do we have a problem? It's let's go figure out why unspecified and retrain the individual classifying the reason for these canceled appointments. And then we'll circle back and decide, like, again, what solutions do we really need to be addressing? But yeah, I hate to say
Excellent.
grunt work, but grunt work.
yep.
Excellent. It goes right back to, that's a big, the grunt work is probably the evaluation,
Yeah,
the data analytics that you referred to earlier and things like that. That's the actual grunt work.
yeah.
Here's a question that I have because you're tied to the healthcare industry. But can you give us an example of a healthcare problem that AI could help solve, and another problem where a simpler technology or process change would be more effective? I guess, like, what are the differences between when you would call in AI versus when you would fix a process in place?
Yeah. One second. I've got a dog, so it's not
We
Hmm.
like dogs. We're dog friendly here.
Yes.
okay. So when it comes to where is AI, we would talk about flavors of AI. I think we'll, talk about L, which is what I think people are talking about when they say AI today. The LLM flavor that I think looking for, new types of engagement, what can today that it couldn't do before. It is very good at working with, the unstructured data, where, you can spend a lot of time doing a lot of review of information, especially like unstructured free text pieces, language interpretation, trying to understand intent are places where, AI is, it's low, but it excels. So, especially
Mm.
in call center spaces, a hospital, these hospitals have been around oftentimes 50 plus years. These are,
Hmm.
not a new industry. So they've got very old technology. They've got in cases hundreds to thousands of phone numbers.
Hmm.
So trying to find even, hospital operators can be difficult to get you to the right place at the, you know, calling in and having a brief conversation with an AI that, is attached to a good that knows all the phone numbers and knows why you should call people. Um, that's a good, because also it's low risk because it's not making a health decision. It's not about patient
Right.
care. It's getting you to someone that can make that decision and not waste their time with, searching through the phone book.
Hmm.
The other places it the healthcare space is I'll point it towards the financial spots, when we talk about, like claims and insurance. And the reason I point it there is because that is a place that is often very, very structured. Financial data always had to have been very structured because, like, if you're wrong in the accounting world, it comes back to you legally very quickly.
Right.
So
Hmm.
whereas, where a doctor note can be all over the ledger's the ledger, and the rules are the rules, and give it structured protocols on, is it going to pass an insurance prior authorization flow or is it not? And so it's in like that where it can kind of reliably make decisions not so open to like human interpretation. That's where I would probably excels in the healthcare space right now. Structured data spaces and in place where determining intent is a low risk but high volume activity like phone call.
Yeah.
Yeah, very good. Yeah, that's uh trying to say like we're talking like grunt work and everything. I don't think there's ever not going to be grunt work in whatever we do. So I think people just need to, accept it. Even with AI, if you want good AI, I mean, I personally want good AI. I don't know about everybody else, but yeah, you definitely got to put that all together. But
Before you
um,
get to the next question, I
yeah.
really liked the analogy of that the person that works there who knows who to call, when to call. I mean, how do
Hmm.
you replace a person like that with AI? It's probably not feasible in most industries. The knowledge, the quickness, oh,
Hmm.
I know this guy. He's been doing this for 30 years. I'm going to give him a call real quick versus the AI would. I don't see how they'd be good enough to replace a person like that. That really made me think about that, how important sometimes a position like a secretary or an office manager is so important to a company, and they're not as
Hmm.
replaceable by AI as people think. So that really got my gears thinking on that one.
Yeah, that's like some of the finer gears of a clock to keep it ticking
Right.
for sure.
Yeah,
But
and
Good.
in the healthcare space, but I'd say it's like the people I want to do the most when it comes to new clients, it's not doctors. I was like, your doctors have been trained for God knows years, and
Mhm.
I'm not going to tell them how to do their job. But the
Hmm.
people that are going to make the most spur of the moment, it is your front desk staff.
Hmm.
Um, let's say those are the people that you just can't replace because of how much is just in their head. You know,
Yes.
written down all of the rules, and they know the document outside and backwards in a way that it's not written down. It's not data.
Absolutely.
It's the same thing with like medical coders and billers. Those are the other people that are just
Hmm.
decisions left and right that's so hard to capture.
Oh yeah, definitely. But yeah, so where do you believe AI can make the greatest difference? And we're talking patient access, scheduling referrals, and other kind of healthcare options that we have.
So I better say I'm going to point back to low risk, high volume activities,
Hmm.
and in places where it can extend the capacity rather than try to replace them. I say it's like I'm sure it'll come up later when we talk about you know patient care and healthcare AI. But I
Yeah.
remind people that it's like the same way if you're an accountant and mistake in Excel, you don't send Excel to prison. Excel doesn't go to court. It's the same thing.
Mm.
Like you do not, by throwing it at AI, not absolve yourself of responsibility.
Yeah,
So it's like,
definitely.
be careful how much you automate if you don't know how it's going to behave.
Hmm.
So I'd say it's like intent routing for call centers, things like looking at insurance claims and denials, looking at, like maybe triaging tasks and saying, which of these should we handle first, opposed to, second or third. And like as soon as you start talking about impacting patient care, that's where I get a little nervous with, kind
Hmm.
of the
Hmm.
flavor of AI,
Right.
where it's interpret to what it thinks the user is going to be with, not necessarily what is the correct decision.
Yeah, definitely. I hear like the low risk, high volume jobs, and those are like you said, mostly the repetitive tasks because the human mind, no matter whose it is, they want to doing a repetitive task and they can get kind of like think off course a little bit because we're built to do more complex tasks and everything. And so when you say those low low risk, high volume, I'm gonna agree with you on that one because yeah, I'm sure lots of paperwork in the medical industry, I would assume. So they always make me fill out a bunch of stuff. So,
Yeah.
Yeah, and let's say that interpretation on like the free tech, like even when it comes to like knowledge management support,
mm,
for tools are like agents that sit at patient's elbow or a op elbow or someone in a medical environment. I worry about it starting to drift into what people are happy with versus what considered the right outcome for said situation. Because those LLMs are looking more so full to not necessarily agree with, not disagree with it.
mm,
Kind of people, especially with people using, constant use of Claude and ChatGPT, almost critical thinking layer
Hmm.
mm,
of, the AI is very good at giving you something that you'll agree with, but it might not give you everything you should have thought of.
Right.
okay.
Okay. So I really like the analogy that you said about the when the accountant uses Excel spreadsheet wrong, nobody goes after spreadsheet. They go after the accountant.
Yep.
It's kind of funny. I'm not sure if you're familiar with this guy, but there was a guy in the United States history called Larry Flint. And I know we have a clean rating, so I won't go into too many details. I don't even know if you know who Larry Flint is, Peyton. I know you're a little younger than Brian and I, but
Yeah.
he was the guy that made Hustler magazine, which was very similar to Playboy magazine, and you can imagine that was a very big deal in the 70s and 80s, and he got sued by a lot of places. And his whole defense was, if a person sells beer to an underage kid, nobody goes after Budweiser. They go after the man who sold it to the child, and he was the one that was being gone after. And he won his case in the
Right.
Supreme Court. And it's one of those things where you bring up a good point. Like if we're using AI to make these important decisions to us, and AI is thinking along an efficiency, not necessarily what's right for the human, we could have some problems there, and nobody's going to go after the AI companies. They're going to go after the individual who makes that call. So it really got, again, you got my gears thinking with that answer. So
Mm.
want to go into the next question. So when it comes to healthcare decisions, they directly affect patient care. I think that's obvious to people who aren't even in the field. So what role should human judgment continue to play as AI becomes more involved in the operation decision making?
Yeah. So I think this is a space where it's like eventually we're going to have to, say like we are going to let AI be the kind of defense here, but not there. Comes to, patient care and healthcare decisions, I don't think there yet. I think the way that doctors use it today is that where, it's, AI does and has even before LLM, like a lot of utilization in imaging and starting to image files and, make some early diagnoses. The idea is that it helps, radiologists, see, 1,000 radiology, where they may have seen 500 before. We're not doubling our number of doctors, but we're, twice as much out of them. That's the idea. It doesn't quite look like that on paper. But in those supporting roles, I think it a lot of potential there in the patient care. Kind of feeding back my earlier comment, very good at showing you something. It's easy to disagree with AI when it's wrong. I think it's very difficult to tell it that it didn't, that, it's missing what it should have said. I think that's a much harder behavior to say, or, to think about when you're like going through your daily tasks is stating like, hey, yeah, I see that you summarized all the information. I did not go through all of it, so I don't know how to tell you that you missed something. Like here's a one sentence in here that says it totally changes the diagnosis. If you omit that, the AI summary looks right. So, at a glance, but had the doctor gone in and seen that one sentence, might change everything. That's a much harder to kind of like quality control for.
Makes total
And,
sense.
like that doctor is like, yeah, like in that scenario, it will not be the AI that goes, to malpractice. It will be the doctor to malpractice.
Hmm.
This is the exact situation we're talking about. So I think it's there, but, I think people just need to constantly remember, like, it's not in charge and it's not accountable.
Mm,
You know, for that would be that's a high risk, high volume area. Is I think it has places where it can definitely leverage, and it can maybe say like, I think it would almost be for maybe the doctor to go in and do the first pass at the AI, give it a confirmation, or like a second set of eyes, rather than seeing a second opinion. Um, yeah, but I say it's
mm,
high risk to that doctor if you are in charge of the first run of it, and I will hand over some of that analysis to you and not me. They
mm.
naturally take on risk.
No, yeah, definitely. Yeah, just because you're using AI doesn't mean somebody else is going to be responsible for it because you're the one that executed it, essentially. That's kind of what I'm hearing a lot there. But uh final question here. AI makes it easier. It's making it easier to generate reports, recommendations, answers, and now evaluation skills of those answers are starting to become more important. In your opinion, what should professionals look for when deciding whether an AI generated result is accurate, useful, worthy of action, etc.?
That's a hard
Yeah.
but I say that one probably goes back to at that point it becomes a very like organizational design question. Like, what does our organization design do? Is the AI giving us analysis
Mm,
that uh, sometimes I have a conversation with clients around, do you want to be data assisted or data driven? Because a lot of will, look for data that agrees with them, and if data says something else, they'll just say, well, we know that there's caveats in the data and that we should really be doing these things instead. It's essentially the answer they got, and rather than go clean up the data, go with their gut. That's kind of like what we were just talking about. Like now people are like, oh, the AI told me, and now I believe it more. Like it feels more like a person that's kind of giving me an out. Um, so really making sure that whatever data your AI is using, if you have a B option, A, B says we're going to do this, B says we're going to do that, we actually go and do those things. We're not ready to like let the data drive decision, you're definitely not ready for AI to go make that evaluation for you. Say before you're ready to let AIs make your report, make sure you're actually a data-driven organization and not falling back on data when it agrees with you and then ignoring it when you know that caveats that have gone unaddressed in those reports.
Definitely.
I love that. We used to say in a school district I worked in many years ago when I first started my career, one of the most important questions we always asked ourselves is, what does the data not tell us? And I'll tell you what, from an evaluation standpoint, that is very positive. When you get all this positive data and you're sitting there looking at the one or two things you want to fix, you're going, well, this data doesn't really tell us if we're doing good or bad in this area we're trying to fix. So it's really a good perspective. I'm glad you brought that up. So thank you. And
Yeah.
Peyton, before we close out, if we have listeners who want to connect with you or Glass Raven, what's the best way for them to do that? What's the best way to get in touch with you?
Yeah, very easy to find on LinkedIn. But I say I'm at my desk all day, and so it pings me all day. We all find us at our website. We're at glassraven.health, just like it sounds. Nothing fancy about it. But reach out to us through there as well.
Perfect.
Sounds good to me. Okay, so yeah, I think kind of wraps it up for about all of our questions here. Peyton, any final thoughts for us before we wrap this up?
No, you guys have tolerated my rambling. I'm about to say I normally give people a warning when talking about these tech spaces that I can go on and on. So you get a very captive,
Hey,
engaged audience.
well, if you listen to any of our podcasts, you know we're the kings of rambling. So that's what we like. You're filling up our time here. So no,
Yeah.
that's okay. But yeah, that's yeah, thank you very much for all that. I think that about wraps it up for this evening. We're hitting about our time here. But either way, I'd like to give everybody a big thank you for taking your time out of your day to listen to us, and especially a big thank you for our guest Peyton Fry here.
Yeah,
Definitely.
thanks, Al. Thanks, Brian.
Yep, no problem. And my name is Brian,
And I'm Adam.
and you have been listening to Layman's AI, and we will see you next time.